Have you been told to do pelvic floor muscle contractions or Kegel exercises while sitting on the toilet? If so, I'm here to tell you that you got some bad advice. This is not a good time to do pelvic floor muscle contraction exercises, and I'm going to tell you why. My name is Dr. Brooke Kolisiak. I'm the owner of Legacy Physical Therapy, and I'm a pelvic physical therapist who is passionate about helping people optimize their pelvic health. When we sit down on the toilet to pee, this is supposed to be a relaxed process that is the culmination of several different reflexes that kind of tell us it's time to let go and let the pee out. So if we start doing a lot of Kegel exercises or pelvic floor muscle contractions, trying to stop and start the flow of urine back and forth, this can mess up that reflexive process. And in turn, we won't necessarily empty our bladder as well, and we can end up with some urinary retention, which means that other bad stuff that's in our urine might stick around too, namely bacteria. This can lead us to potentially a greater risk factor for developing a urinary tract infection or a bladder infection. So instead of frequently practicing starting and stopping the flow of urine while sitting on the toilet, we should just sit down, relax, and let the pee flow. It is not a time where we want that start and stop action to happen over and over, because again, that can mess with the normal reflexive patterns that tell our bladder to empty fully. So a contraction of the pelvic floor is a Kegel exercise, and oftentimes people associate this with stopping the flow of urine, because that is one of the functions of the pelvic floor muscles. So when you do contract the pelvic floor, it will or should stop the flow of urine. So naturally, people think that a good time to practice this exercise is when you are sitting down on the toilet. But I'm here to tell you that information is wrong. Because stopping the flow of urine is one of the functions of the pelvic floor muscles, you can occasionally, maybe once every couple weeks, try to stop the flow of urine midstream. This will help you identify how strong or weak your pelvic floor muscles may be. So we should be able to have our urine stream going midstream and be able to stop it by contracting our pelvic floor muscles. If you can't stop it, that is a sign that your pelvic floor muscles may be too weak or aren't coordinating together well, or you might not be even using the right muscles. If you can slow it down or deflect the stream a little bit when you try to stop it, that might mean that the pelvic floor muscles are altogether a little bit too weak, or maybe one side is weaker than the other, and that's why we're getting the stream deflected a little bit. So if you're wondering about your pelvic floor muscle strength, it is okay to try and stop the flow once every couple of weeks or so to see if your pelvic floor muscles are working appropriately. But again, this is not a time when you're sitting on the toilet, is not a time when you should be repetitively trying to stop and start the flow of urine. Instead, sit down, relax, and let it flow. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.